Dr. Sanmi Areola is an environmental toxicologist with the Metro Public Health Department. Welcome, doctor.
Thanks for having me.
Of course. We know spring is just around the corner. We have had a very mild winter in Middle Tennessee, which brings to mind the proposition of staying clear of mosquitoes. And I think we probably need to be a little concerned because of the mild temperatures. We may have a pretty active season. Why is mosquito control so important for the community?
Yeah, those pesky little insects, they affect our quality of life. They bite us. But more importantly, they are able to spread diseases. They are pests of public health significance, and across the world, they're linked to malaria, chikungunya, West Nile virus, Zika virus diseases. So it's very, very important for us to, even though we haven't been successful in eliminating them, we have very proven approaches to managing them, controlling their opportunities to cause diseases, controlling their opportunities to bite, reducing where they breed. So for a variety of public health reasons, for things that pertains to quality of life, people being able to enjoy their backyard, ensuring that people can run around the community, but more importantly to make sure that we protect the health of the people. It is very, very important to manage mosquitoes, to control them, to make sure that places where they breed, we control that, but also to make sure that as persons, as individuals, we take steps to reduce opportunity for them to bite us. But mosquitoes are by far probably the most important pest of public health significance across the world.
All right, so as far as empowering us, members of the public, homeowners, apartment dwellers, whatever you call home, to protect your environment, what can we do to keep ourselves from being bitten and to reduce the population of mosquitoes around us from them breeding in our backyard or on our patio?
Yeah, and there's some very, very basic steps that we take. The health department, like every other mosquito control district, have steps that we take. But we can't do it by ourselves. We do need community members to play their role. Mosquitoes can breed anywhere. So think about this. A bottle cap that holds water for more than 3 days is enough for hundreds of mosquitoes to breed. So they can breed on leaves if it can hold water. They can breed on tree holes. Anything that can hold water, they will breed. So one of the things to keep in mind is in our homes, we keep our vegetation cut and low, so we don't give them opportunities to breed. Anything that can hold water, we either turn them over, we cover water storage containers there. If we have to hold water for more than 3 to 7 days, we put mosquito dunks. These are very, very easy steps to take. If there are things like ditches in the home that can hold water, we'll fill them up. Those are steps that we can take to prevent and reduce mosquito breeding. Helpful not just to us in our homes, but helpful to the community at large. Now, we are not going to be successful in preventing mosquitoes from breeding. We want to reduce the number. So there's going to be some mosquitoes. The idea then is when you have to be outside, there are steps that you can take to prevent mosquito bites. There are also steps that you can take to prevent the mosquitoes from coming into your home. So one of those is making sure that you have the screens intact. Make sure you don't have holes there. And if you have to be outside, wear long sleeve shirt, long sleeve long pants, wear one of those EPA approved mosquito repellents like DEET, picaridin, all of lemon eucalyptus. It's also important because we are the health department to tell people when you do follow label instructions. It's also okay to apply those things on pregnant women. It's okay to apply on children that are more than 2 months old. If you're applying on a child that's 2 months old, you put it in your hand and you rub it on their face and their bodies. So those have been proven to be safe. They've been tested. So in summary, there are things you can do to prevent mosquito breeding. There are steps you can do to prevent mosquito bites.
And of course, the concern is if you do get a mosquito bite, if it would be carrying West Nile virus or Zika, that's the reason you want to eliminate mosquitoes and protect yourself. That's the bottom line, right? And tell us why those can be dangerous.
Yeah, those are the bottom lines now in this part of the world. Zika is relatively new to us. The past 10, 12 years, we've been focused more on West Nile virus. I think it's important to understand there are different species, different types of mosquitoes. Here we have mosquitoes that obviously can carry West Nile virus. So West Nile virus, 1 in 5, most people are just going to have no symptoms or flu-like symptoms. But there's a few that would develop really serious diseases that are very bad. Same thing with Zika virus. Most people with Zika virus are now going to show symptoms. So there's a few, especially pregnant women, the fetuses that are more susceptible to those things. Right now, those are the 2 key things that we are trying to prevent in Nashville. But historically, in different parts of the world, mosquitoes have been linked to so many diseases. For Nashville now, the 2 primary concerns are West Nile virus and Zika virus. And I think we've taken steps to kind of reduce the risk of transmission in Nashville. And we plan to continue to do that for both of them. Things we talked about are important is prevent mosquito breeding, prevent mosquito bites. And if you have any of those symptoms that we talk about, quickly get your primary care provider and make sure that steps are taken to reduce the risk to you or to your fetus.
Also, it's important to note in our last 30 seconds or so, Zika can be transmitted from person to person, not West Nile. So if you do get Zika, you are contagious.
Yes,
it can be spread.
Zika can be spread. Zika, once it gets into the body, can build enough load of the virus that when another mosquito bites, the mosquito becomes infected. That's not true for West Nile virus. That infected mosquito will infect every other person that they bite. You can also transmit Zika by sex with your partner. There's also transmission through blood transfusion. So Zika is a little bit more dangerous person-to-person contact than West Nile virus.
Okay, and in the last few seconds, as we move through mosquito season, the best way to stay informed?
www.nashville
health.nashville.gov.
Yes.
Health.nashville.gov. There you go.
Yes.
Thank you so much, Doctor. Really good information. All right, thank you.
Thank you.
And we'll be right back after this.